Ripley Burkhardt. I'm going to be your massage therapist today.
Hi, I'm Julian. Nice to meet you.
All right, I see you completed the intake form for me. Can I take a look at that for a second?
Of course.
Okay, so I see you have some leg pain and some back pain.
Correct.
So when all did that start?
It started roughly a couple weeks ago when I started working.
Okay, a few weeks ago. Can you tell me more about that? Like, is there anything specific that you did?
Nothing specific. I'm a mechanic, so it's just very labor intensive and kind of hard on the body. So like bending over and pushing cars in kind of strains the muscles.
Definitely. Do you say like the pain like increases throughout the day, or do you think it stays the same?
It pretty much stays the same. It's more of a sore, tense, like tight feeling rather than like hurting.
Okay, so like it's like tight muscles.
Yes.
Okay. Does anything make it worse? Does anything make it better?
Sometimes stretching, like touching the floor while I'm standing, like reaching for my toes helps, but other than that, like the weekend helps because I'm not working. Like time off helps.
Do you do anything else besides like mechanic work or?
Yeah, I ride my mountain bike and ride my dirt bikes and quads, but other than that, that's really it.
Does that have a factor into it at all? Like, does it make your back any worse, any better?
Sometimes, like if I crash, it'll like hurt depending on how I fall, but it usually doesn't cause me any discomfort.
Do you think it stretches you out a little bit? Do you think it helps?
Biking helps, but dirt biking, quad riding, not really. Because it's got, it involves less movement.
Yeah, that makes sense. Do you have any like specific words to describe the pain?
No, just tight and sore. That's really it.
Tight and sore. On a scale from 1 to 10, 10 being the worst possible pain, what are you feeling currently?
Currently, probably like a 5 or a 6.
5 or 6.
Nothing crazy, but you could feel it just sitting here.
Mm-hmm. And then for like the pain, like whenever it's like the worst possible pain that you have, like what is that on a scale from 1 to 10?
Like opposed to like breaking it, like just everyday stuff.
Yeah, like whatever, like the pain is like the worst, like 1's a really good day, or like say like on that day it's like the worst pain, like 1 to 10.
Usually when it's worse, it's like probably like a 7.
A 7. Does it get any worse than that? Doing anything like?
No. Anytime I wake up like in the morning and it feels like worse than it usually is, I take it easy so I don't like strain it even more.
Okay. Do you not like push cars in that day? Like you?
I do. I just take it easy. I don't push as hard or lift as hard, or I just take my time for the day.
Okay, that makes sense. Can you show me where the pain is right now, like just pointing to it?
Yeah, it's kind of like front of my leg,
Okay.
a little bit of my knee, and then like my calf.
Okay.
And then for the back, it's usually mid to lower back, like kind of like right above the hip bones.
Okay, and do you know when the pain has started?
No, it just comes and goes. Just depends on how the work week has been. Like if it's a lot of like engine work and I'm like bending over a lot, then it strains my lower back. Or if I'm working above my head, then it's usually my legs from like tiptoeing and everything.
So just depending on like what you're doing at work, it just
Yeah.
depends on how the week is gonna go.
Yeah, it just depends on the jobs I get.
Okay. Is the pain consistent, or does it ever get any better or any easier?
I mean, it gets easier if I take it easy, and doesn't really get worse. It kind of just like levels out.
Okay. Just levels out. And do you have any like prior history of like any back pain?
When I was younger, I bruised my spine.
Bruised spine. Can you elaborate on that for me? What happened?
I was sled riding and I wrecked.
Sled riding. It's almost that time again.
Yes.
Sled riding and wrecked. Okay. How old were you whenever that happened?
I was probably like 5th grade.
5th grade. So what's that about, like
8, 9, 10, something like that.
Oh, okay. So like you were like pretty young.
Yeah.
8 years old about. And then did you do anything for that? Did you do any physical therapy? Did you just
No, I just slept on the floor to like stretch my back and like level it out, and I took a couple days off of school until I was able to function again.
Oh, okay. Yeah, that definitely sounds very painful.
Mm-hmm.
Do you have any other history of like any breaks, sprains?
Yeah, when I was probably like 3 years ago,
Okay.
I broke my foot and my ankle at the same
jeez.
time. But other than that, just the typical, rolled ankle or sprains or strains. That's really it.
Okay, for your like broken foot and your ankle, how old were you and what were you doing when that happened?
And I was about 16, and I was riding my bike and I wrecked.
Riding your bike and wrecked. For that, like, were you in a cast? Did you have to get any surgery, any plates or put in, or?
No, I didn't get any surgery, and they put me in an air cast, so I was able to regulate how much pressure and everything I can set it on, because when I broke it, it didn't give me a cast because it didn't swell, and they were afraid if they put a cast on, it would swell up and then cause me more damage, so they put me in a soft cast.
Okay. And do you have any other like history of any surgeries, anything else?
Yeah, I cut my thumb open in my hand really good about 2 years ago.
That's probably about 2021, right?
Yeah, roughly.
Okay. And can you explain to me a little bit more?
I was at work and I got cut by a razor.
Ow.
Yeah. And it cut my digital nerve on my right hand on the inside of my thumb.
And what did they have to do to fix that?
So I had to get one surgery to stop the bleeding, and then they had to schedule me to get an MRI and check out my nerve and everything, and I did cut it, so I had to get a second surgery, and they had to give me a nerve block. And then I was in a cast for about, I want to say like 4 or 5 months.
Okay. And after you got out of the cast, after those 2 surgeries, did you have to do any physical therapy or anything like that? Or what all did they tell you to do?
They said kind of play it by ear. I did not get any physical therapy, but I did take it easy. And I wasn't allowed to do any physical sports or anything like that for about a year until my nerve grew like 100% back together.
Did you have to take off of work for that then? Is that
Yeah, I was off work for several months.
off work? Okay. Do any of those prior injuries still affect you today? Like, is it causing any of your back pain, any of your leg pain?
Yeah, every now and then I'll get like my lower back or my mid back would hurt.
Okay.
Then I have like a numb feeling on my right side of my thumb, right where I cut the nerve, and then I have arthritis on my right ankle, the one that also got broken a couple years ago.
Okay. And then on here it says that you have like a stabbing pain in your thighs.
Yeah, around that area. It's usually whenever it's sore and tight.
Oh, okay.
So like whenever it's like super tight and I like squat down and pick up tires or transmission or an engine, it strains my legs.
Oh, okay. And then I see that you put that you take allergy medicine for like just like headaches and like stuffiness.
Yeah.
Do you take anything else?
No.
Or just that? Okay. And on here you said that you have like seasonal allergies. Is that correct? And you said you are allergic to animals.
Correct.
And you do wear contacts?
Yes, occasionally.
Okay. So what would be your goal for the session today? Anything in particular, or?
Just working on the stiffness in my back and my legs.
Okay.
Trying to get it loosened up.
Okay, that sounds good. So from just what you said to me today, so we're gonna do just a full body massage. We're gonna work on like all the stiffness and all the tightness. We're just gonna try to get that out of there. And then I'm gonna have you come back in a week, and then we'll really like get into it, and we'll really start to, you know, like work out all like the knots and all like everything else that's affecting like your back and your legs, possibly like your ankles if they're, you know, sore that day. Do you have any questions for me going forward?
Nope, nothing in particular.
Okay, and then if the session does go well, I can get you rescheduled, okay?
Awesome, sounds good.
All right, it was really nice to meet you.
Nice to meet you, thank you.
Thank you.